Good afternoon, everyone, and welcome to a special edition of SADS Live. This is our Mother's Day special today. So, all of you moms out there, I hope you're listening and tuning in and getting all of your questions ready because we have quite a panel for you today. But before we get to all of that, I wanted to make you aware of a few different things that are going on at SADS, and we have just a few announcements. One is that Dr. Sam Sears, who is a cardiac psychologist, he is presenting a SADS webinar about living life with a sense of purpose and joy. I have personally met Dr. Sears and watched him speak, and you won't want to miss this. He is dynamic. And that is happening on Tuesday, May 20th at 7:30 in the evening, Eastern time, 7:30 Eastern time. And then the next piece of information we want to share with you is that the SADS Foundation in-person seminar at NYU at the Langone Health in New York City is coming up Saturday, May 31st. So you can still get information about that by going to sads.org. And No Ball at All is happening right now. And if you're not familiar with it, it's exactly what it sounds like. We don't have a ball. And the reason we don't is because we want all of the proceeds to go to helping SADS families like yours. And so all we ask is for you to donate. And this year it is in memory and honor of 12-year-old Bella Gonzalez. Her first symptom was her last. We later found out that she had ARVC, and her mother now is reaching out to the community in many different ways and very involved in SADS, including with No Ball at All. To find out more about No Ball at All and how you can donate, go to our website at sads.org and click on that big red donate button, and you can find out all you need to know right there. Lastly, I want to mention that we have something new coming, and that's a SADS Parents Connection. This is a new support group, and it meets the first Tuesday of every month at 7:30 Eastern Time. With that, it's time to get to our dynamic panel. And we are so lucky today to have three mothers. Alessandra is one of our mothers, and she will be talking to you about long QT and her experience between her and her child and their family history. And then we have Christy Johnson, who serves on our board, and she will be representing ACM or ARVC. And then Allie Hoth, who actually works here with us, and she is a mother as well and has CPVT and will be addressing what life is like raising a child, a young child with CPVT, and dealing with it on her own as well. So I want to welcome everybody to the screen to join us as we start to talk a little bit about being moms and being moms with SADS conditions. And here you all come. There you are. So I think just to begin, I want to say thank you. It's not easy to come on a program and talk about some ups and downs in our lives and how we handle day to day as mothers, SADS conditions and SADS conditions for our children. And so thank you. Thank you for doing this and making yourselves open to it. I want to take a moment to let each of you introduce yourselves and give us a little bit of background about who you are and, your children as well. So I think let's go ahead and begin with Sandy. Sandy, I think I forgot to mention your name, and I am so sorry. Sandy Cowan is also on our board and is here to talk about Brugada syndrome. So now it seems absolutely perfect to have you speak first.
Thanks so much, Jen. Hi, everyone. My name is Sandy Cowan. As Jen said, I do have Brugada syndrome. My story started when my father was diagnosed in 2009 and passed away very soon thereafter from Brugada syndrome. He had been having symptoms his whole life, but at that point, nobody really knew anything about it. So 7 years after he died, I was diagnosed with Brugada in 2016. I currently am a low risk at this point. I do have a implanted link monitor, so they can track what's going on and see if at any point I do become a higher risk. I also have a 21-year-old son who has been monitored his whole life. He was very young when my dad died. So he's been monitored and has shown signs throughout the years that he might have Brugada. However, I have always tested negative with genetic testing. My son tested negative as well. So it's still kind of hanging over us whether or not he has it. Very recently, he has been displaying some more signs. He's been going in and out of AFib recently. So we're at the point where he is going to have a monitor implanted. Next week, actually, we're going down to NYU Langone, and we'll go from there. So we're taking it one step at a time.
Okay, thank you so much for sharing. And of course, we're wishing your son all the very best as you begin to try and figure this out with him. All right, so let's go to Alessandra, who you'll recognize her last name because her daughter is infamous with her Instagram channel where she interviews all sorts of people. She did it at our SADS conference, so I bet you already know which name I'm going to say. Her daughter is Adeline. And Alessandra, thank you so much for joining us today.
Yeah, thanks for having me, and happy Mother's Day to everyone. So actually when Adeline, she's 9 now, but when she was born, her heart was going in and out of arrhythmia called torsades de pointes. She was born at a regional hospital. She was life flighted to Duke University Hospital, where they're trying to figure out what's going on. Why is this, baby doing this? Listening to my husband's health history, sort of targeted long QT syndrome. He had a history of fainting. He had, family members that had died relatively young, and they tried cardioversion. It wasn't effective. So eventually what got her out of the arrhythmia was a heavy dose of lidocaine. She was in the hospital for a few weeks, but at week 2, she had a pacemaker implanted. And while we were in the hospital, the doctors encouraged us to reach out to the SADS Foundation, which we did. SADS connected us to another mother in North Carolina who was tremendously helpful to get advice of, like, in the moment in the hospital, what things you should ask for, what you should be doing. And they also said, hey, you should get in touch with family members because this is genetic. My husband's father reached out to his brother who said, I think something's going on, you should probably get checked out. They had a tense relationship. Unfortunately, he knew about that. His son had long QT syndrome, and he had 3 grandchildren with long QT syndrome type 2, which was frustrating, but at the same time was able to help us sort of target Adeline's treatment to be a little bit more effective. Today, she's doing really well, as you can see on social media. She takes beta blocker, she takes mixilotine, she has her pacemaker, and she takes a variety of medicines to make sure her potassium levels stay good. But as you know, long QT female entering puberty does not come without risks. So thank you for having me.
Absolutely. We feel very fortunate to have you here. Thank you. And Christy Johnson, who also serves on our board. And we're so happy to have you today. You are so involved with SADS, and we're just fortunate. So we'd love to hear a little bit about your story as well.
Thanks, Jen. Yes, and I'm so happy to be here. And yes, I love SADS, and I had an opportunity to meet a lot of people in person actually last week, and I just can't tell you how wonderful this staff is of SADS. So just a terrific organization, and I'm really happy to be here. So my story started in April of 2020. And if anyone else is thinking that's kind of the date, yeah, that's a COVID date, right? Well, yes. So I, of course, decided to go into sustained VT out of the clear blue sky in April of 2020. Was tested for COVID about 3 times in the hospital, but no, it was not COVID. It was, of course, arrhythmogenic cardiomyopathy, but they didn't know that at the time. And I actually did have a family history. So my father died in his sleep at age 52. He was the healthiest man I knew. He was an exercise fanatic. And my aunt died of heart failure at age 60 after battling it for 20 years. They assumed she had a virus. So that was my family history going into the hospital. It was interesting because after that family history, they thought maybe she has something genetic. We need to have her tested immediately. So they did send a genetic test off in the hospital. After they stabilized me, it was sustained VT. So Alessandra, I heard about lidocaine. That was actually what got me out of sustained VT as well, was intravenous lidocaine. But I was, unfortunately cardioverted 3 different times and all kinds of procedures in the ICU for a week. So it was a very traumatic family start. But I did stabilize. I did get out, which was great. And immediately when my genetic test came back, we tested my 2 daughters. I have a younger daughter, Carly, and an older daughter, Cassidy. And they did an MRI even before the genetic testing came back. And on her first day of moving into college at age 17, we got a call from the doctor on a Sunday saying that they knew from her MRI that she was positive for arrhythmogenic cardiomyopathy. So sorry, get a little emotional. But 5 years later, Cassidy is thriving. She's doing great. She's a first-year medical student. She has an ICD implanted. She did have one issue with non-sustained BT, but she has been very stable since then, knock on wood, and is thriving in her life. So we'll talk more about that later, but that is my generic first part of my story, and I'd love to answer questions and talk a little bit more, Jen. Thank you.
Thank you so much. And our hearts are with you. Of course, we all understand as being mothers of children with SADS conditions and SAD conditions ourselves, which brings me also to Allie Hoth, who works here at SADS and is an integral part of our staff. And I want to talk to you, Allie, a little bit about your experience, which was much more recent, and what you've discovered in your family regarding CPVT.
Yeah, hi everyone. My name is Allie. So my journey started on December 11th of 2023. My brother, who is 16 at the time, went into cardiac arrest while lifting weights. And he was invited to our children's hospital. And he was there for about a week, and they found out that he had CPVT through genetic testing and stress tests. I was diagnosed in February of 2024 with CPVT. Since then, I have been on beta blockers, and I've also had the LCSD surgery. Not long after I was diagnosed, we found out my son has a genetic component for that as well and has CPVT. So it's been kind of a crazy journey the last, year and a half or so. But it's been incredible, and SADS has been a huge lifeline for me. Shortly after I was diagnosed, an opportunity came up at SADS for a position here, and I applied, and it's felt like home ever since. And the community that is with SADS is incredible. And Christy, don't apologize for being emotional, because every SAD journey is emotional. I'm trying not to talk right now, but it's just a part of the journey. So SADS is incredible, and even though everyone's journey is different, we're all here for each other, and it's the community. So that's a little bit about us. And I don't know if I mentioned, but my son is 2. We are at the beginning of his treatment, as well as, sort of at the beginning of the treatment for my whole family, because not only was my brother and I diagnosed, my little sister, who is 13, was diagnosed as well. And my brother was diagnosed. My brother was diagnosed, sorry. So there's quite a few of us that have it, and we're still in the beginning stages of figuring out treatment and, the lifelong journey of our SADS, condition.
Absolutely. And the last person to share, I guess, is me. And I am also a mother, and I have CPVT as well. And both of my sons were diagnosed with CPVT. Unfortunately, my younger son, Frankie, who some of you may already know quite a bit about because of No Ball last year being in his memory, passed away at 10 years old. From a cardiac arrest. And at the time, we did not know that he had CPVT. He had nobody else that had caught it. And so he had passed away. And then 4 years later, as we were still questioning why he passed away, our older son, Sammy, who is now getting ready to go off to college, had a cardiac arrest very suddenly, and he was pronounced dead and was down for 5 minutes completely. he had been worked on for over 2 hours, and then they pronounced him dead and they cleared the room. And 5 minutes later, he woke up on his own. It was miraculous. And because of that, he had a little bit of a few strokes in his spine. So he deals with paraplegia now, but he is all there, and that is what we are most grateful for. And because of him, we learned that our younger son had CPVT, he has CPVT, and I have CPVT as the de novo case. So my heart is very much with all of you. I know obviously what it's like to be a mom, and a mom with SADS, with a SADS condition, and a child with a SADS condition. And with that, I think it would be great to dive a little deeper so the other mothers out there can get an idea of kind of how we see life and how we prepare ourselves and parent through all of it. And so with that, I'm wondering if you could give maybe 3 words to describe your child or children that have a SADS condition. So let's start with, well, this is fun. I love being able to call out people. Christy, let's start with you.
All right, excellent. So 3 words to describe Cassidy. She's a fighter, first of all. So I would say ambitious. She is very ambitious. This diagnosis was not going to stop Cassidy. So when she was diagnosed, she knew she wanted to be a doctor from an early age. And I thought, that sounds like a terrible idea with a very high stress career. But she is ambitious and determined, and she is doing excellent in her first year of medical school. And she gets up every day and does her 4-mile walk. She's very ambitious. She's also very focused, is my second word, because she is right now, actually, she came home to surprise me for Mother's Day. She said she wasn't going to get to see me because she has an exam on Monday. She's here in my house, but she's studying remotely right now. I'm telling you, that girl is focused. She can look at something that I could never look at forever. And I sort of mentioned this before, but courageous. I mean, she is so brave, and also loves to talk to younger kids and young adults who are diagnosed with arrhythmogenic cardiomyopathy. So if you have a child like that, please reach out to me. She's a wonderful mentor and somebody who's been through a lot that would absolutely love to talk to your child. So,
what a wonderful Mother's Day surprise. I love that she surprised you. It's interesting to see how children, I know she's older now, but they're still our children, yes. To see how children process this a bit differently from us. And I know in my situation, I've learned so much from my son going through this. He is the one that has kept me up when I want to sink down. So with that, let's also speak to Alessandra. And what are your 3 words? I can't wait to hear this, because Adeline, we could go on forever. She's got a big personality.
I appreciate that. I actually call her my golden retriever, and that's not the adjective I'll use, but I'll go with sweet, because she is just so sweet and loving person. She just loves making friends. She wants, to spread happiness. And she really is, like, what you see is genuine. I would say she's strong. She deals with so much with grace. And I'd also say she's very empathetic. And I think that comes from knowing that she deals with so much behind the scenes that a lot of people wouldn't have any idea. I think she just has that orientation that anyone could be dealing with something that you would have no idea. And so that's just like, she's had this since she was a baby. So that's just what she expects, right?
I have a feeling one day she might be sitting in my seat and hosting her own program. And I don't think it's that far away. All right. And Allie, what would you say are 3 words to describe your little Huddy? He's so cute.
Yeah, my little Huddy. So he's 2, and 3 words that I would use to describe him. The first one is active. He is constantly go, go, go everywhere. And he is running, he's just super busy and active. The next one, I would say that he's resilient. You kind of have to be resilient when you're going through a condition or, your own SADS journey, and he is very resilient. Since we're just at the beginning of our treatment, there's a long road ahead for us. Because like I said, it is a lifelong journey, and being resilient is huge. And I'm so glad that he's able to be resilient, at such a young age, because I wish that I, could be as resilient as him in some situations. And the last one, he's definitely headstrong. He knows what he wants when he wants, even if he's 2 years old and he doesn't have the words for it. He'll show you, or he'll try and tell you what he wants. And I think, throughout his life, I hope that he continues to have that and what he wants and when he wants it, and that he can, grow and develop into a wonderful young man. But those are 3 words that I would use to describe Huddy.
I love it. And Sandy, can you share with us your 3 words?
Yes, thank you. Jackson, again, he's 21 and he is driven. When I think of him, I just think he's driven. He can set a goal and he will crush it. It doesn't matter how hard it is. He has no excuses. It's consider it done. He's amazing. He's very happy. He's just he's always been a joyful child. As he gets older, he just exudes like happiness. He wants to make other people happy. And he's very thoughtful. He's a really kind young man, and very proud of him.
I love that. Thank you all for sharing that. I feel like I want to chime in, and I would say I've learned so much from my son through this whole process. And zest is the first word that comes to mind. He has a zest for life like I have never seen, obviously, pulling himself out from the depths of death and coming back. And the next thing I would say is that he's curious, so very curious about our world and the way our minds work and our bodies work. And the last thing I would say is that he is very much a teacher. It helps him to teach people about what he knows, and he finds it, very rewarding. So you can imagine with those 3 attributes what it's like, feeling like I'm learning from him. But I think something that we've all touched on is all of our children seem to be so positive. And that's a wonderful way to be. And I think all of us are probably have some positivity in us as well. But I think when you're young, it's harder to see the whole picture. And I just wonder how you feel your children's dealing with a SADS condition differs from your own being the parent. And let's start. I'm going to go back to you, Sandy. Why don't you tell us a little bit about that?
Sure. I think Jackson, he was so young when my dad died. And so his whole life, he has been, going to cardiologists. We drive down 2 hours to get to New York to see the specialists and all of that. So he's always had this in his life. But one of the things that, I think his lens is very different than mine. Mine comes from a very, anxious, trying to protect and make sure we're doing all the right things. But I think his experiences, this is just my norm, I guess, because he was so young when, he didn't know any of this was happening. So from his perspective, this is his norm. One of the things I've always said to him is, in an effort to try to, it's that delicate balance of letting them live their life and without crippling them with fear, So it's a delicate balance. But when he was younger, why do I have to go here? Well, every family has something in their family. Some people deal with other things that we don't have to deal with. This is our something, and we will deal with it as it comes along, in hopes to try to help him not feel anxious about it. But I think as he's getting older, I do notice myself coming from a more anxious place because he's out of my control now. He's at 21 and he's in college and he can make his own decisions. And, so me checking in, he's like, I'm good, Mom. I'm fine. I know what I'm supposed to do. I know what I'm not supposed to do. I'm doing the right things, So I think his lens is very different than mine, and it is very positive, and which is great.
That's wonderful to hear. And I can't imagine how difficult it is to say he's an adult and now he can do it himself. Now let's all just pray he does it. Alessandra, can you tell us a little bit about how things differ between you and the way your child might handle things?
Yeah, actually, it's interesting. I feel a lot of resonance with what Sandy was saying because as Adeline's getting older and a little bit more independence, I mean, she has had this since she was born, so she doesn't know any different. And her father and I have always worked really hard behind the scenes to create a seamless infrastructure that she may or may not have really known much about, right? Like all those conversations with schools, with teachers, with parents that she's seeing to make sure that everyone's prepared in case something happens. Those conversations didn't really happen in front of her. But now as she's getting older and there's more of that drop off, or I'm not sure who you're going to be interacting with, like there is more of an open communication, and I'd say maybe increased anxiety on my part and more awareness on hers. But again, she just has this orientation of like, this is the way it is. Like I don't know something different. Whereas, you know, a child that may have been diagnosed a lot later and have like that before and after moment as a comparison.
Yeah, that makes sense. That makes a lot of sense. Thank you so much for sharing that. So let's now go, who haven't we talked to? Allie, tell us a little bit about the differences.
Yeah, so since we're still, like I said at the beginning of treatment, it's a little bit different for us because we don't have, you know, years of treatment under our belt or years of going down to, you know, the children's hospital that's a couple hours away. But with my son, he doesn't have the comprehension to understand what's going on because he's only 2 years old. And so to him, every day is a new day. And every day he lives without boundaries. Like he loves to go play on the playground. He loves to play in the backyard all day long. And so you can't really tell him, hey, you can't go do that. You can't go run around. And because that's just not who he is. And so his lens as a little kid is incredible to be able to witness that because even though he has this condition, he doesn't let it affect him at all. Well, partly because he can't comprehend it, but that's just how he does it. For me, it's a little bit different because I have, a little bit of anxiety when it comes to things and doing things, but he just goes full force in everything he does. That's kind of the difference between us.
I would imagine that that's very difficult having a young child, and maybe some of you can speak to this because you've been through these stages with your children. But I would imagine it's really difficult to have a young child who doesn't understand what's going on, and they just want to do everything that other kids are doing. And it's not that they can't, but the amount of worry and anxiety as a parent, like somebody said earlier, you don't want to kind of put them in jail in a sense and have all this fear of you can't do a myriad of things and you have to be worried all the time versus, saying everything's great and you have nothing to worry about. So I definitely think that brings a whole different level of parenting to the table. And I'm sure, Christy, you can probably speak to that because, you've been raising your girls and been through different stages, I'm sure.
Yeah. And I was thinking about this as I'm hearing other people talk and for Cassidy, the transition has really been a journey as well. Mm-hmm. It was very hard at first when she found out. She is an endurance athlete. She was going to do a triathlon in college. And for those of you with ACM out there, you know that generally that is not a recommended thing with ACM, right? Is endurance exercises. They pretty much, put the kibosh on that for her immediately. They told her that she could not do her distance running and distance swimming and distance cycling at all. So she actually, it was really hard, but she transitioned that. Now she's a yoga instructor and she's very interested in integrative health in her medical school career. So she's actually going to go to a thing there. So she changed, which was really good, but it was a journey. Telling someone that they have to give up something that they really love is really hard, of course. Yeah. And for somebody like Cassidy, who's extremely focused and ambitious, she didn't love that. She had a hard time with it. Her ICD implant was also very hard. It was a very hard time in all of our lives. Sure. Because that was really different. For me, I was so grateful to have an ICD so that my life would be saved. And I've used it 13 times, right? It shocked me. And I'm very grateful. For her, it was, I'm young, I'm 17, I can't believe I need this thing. But again, she's come around, and like Sandy's son, has transitioned more to, okay, this is saving my life. I can use this experience to help others, especially as a doctor. She's become more empathetic. She's become someone who has different activities than I expected her to have in her young life. You know, she was an athlete. Now she is somebody who is creative. She's still an athlete, but in a different way. And I think that for me, you know, I have a lot more anxiety than she does now, I would say. Although she certainly has come a long way. So I say right in the start, she did. But I highly recommend counseling for those of you who are on the board about anxiety and, you know, do I need help? I think everyone could use a little help, especially at the beginning of a journey. But even 5 years in, I still rely on counseling when I need it, and for her as well. So
yeah, I'm so glad you brought up a couple different things there that I'd love to dig a little more into. And when you speak about counseling, both, I'm certain you're speaking both for yourself and if possible for your children. I want to encourage everybody to remember that the last announcement I made today was that we have a new group called the SADS Parent Connection, and that is a support group. So while that's not traditional counseling, it is a place you can go maybe while you're trying to figure out what kind of counseling would be appropriate for you and your family. But I will second that, Christy. Our family has been through tremendous counseling, and I continue to go through counseling, and I think it helps to calm some of those anxieties as a mother trying to parent through all of this. And I think it's great for the kids too. I think, you know, every child, and just like every adult, is different, and sometimes teenagers are more resistant or less willing to talk about things, especially boys. And I think, you know, when I think about my son, he did the counseling, but after a while it was kind of, I'm okay. My therapist says I'm okay. I'm done talking about this. And sometimes it's like pulling teeth to try and get information. And I always try and communicate, that stresses me out. It's better when you tell me everything's taken care of, yes to everything, and then I can start to relax. So I think there's that level of keeping an open communication between you and your kids, so that everybody can stay calm, but writing that parent line of, I don't want to be too forceful or too involved where you don't want to tell me anything. So Alessandra, as you see Adeline getting older, has it changed the parenting for you?
Yes. I mean, so as everybody, right, your kid has still all those other things that are developmentally appropriate. This is just another layer that you're dealing on. We are also a family that subscribes to mental health support to help sort of like keep a balance of everything. In terms of my parenting approach, I almost wish that sometimes it came in a little bit more, in that just, you know, we have these normal mom daughter like stressors, and like, you know, you're not listening, you're not doing what I'm asking you to do, you're not getting ready, we're running late. And then when I have a moment later to like stop and think about it, I'm like, my goodness, all the things that this girl is dealing with in a day, and here I am, you know, flustered about like she's not packing her bag in a way that I want her to, you know. And so sometimes I wish that I did take a little bit more time, or, you know, that sentiment could creep in live in the moment, to have a little bit more grace and patience.
Yes, thank you so much for sharing that. I know how much it changes, obviously, as I'm going through it too. And I think I'm hoping very helpful to all of you out there to hear kind of these different takes on how we've handled this at different stages. And now I really want to, with our last little bit of time here, want to turn the attention to us, to moms. You know, it's not an easy job. And I think as we approach Mother's Day, it's important to figure out, how do I de-stress? How do I find time just for me? and how do I do all of that when I have all of this to worry about and myself? So tell me, Sandy, what do you do to de-stress? How do you celebrate Mother's Day without, all of it kind of getting to you?
Yeah, excuse me. One of the things that I love to do, our family loves to, walk in the neighborhood, go on bike rides, things like that. We're a very active family. But with my son, he is a runner, and he is an avid runner, I should say. And one of the things I love to do with him is I'll ride my bike and he will run, and we have the best time. It's that time for us to, like, he will share things with me that maybe if we're just sitting down talking, it's uncomfortable or whatever, but it's our time to connect, and I absolutely love doing that with him. So that's one of my favorite things. So he's coming home from school in a few days, so I hope we can.
Oh, great Mother's Day present.
Yeah,
Lovely. Christy, what do you do to de-stress, especially as we talk about coming into Mother's Day?
Yes, thank you. So I am right now an empty nester. So for the first year, I've got two children now in college. My younger one is in college as well. So that has opened, and I'm sorry for those with lots of young children who are like, yeah, we know. But it is really great. I have a morning routine, which you can still have too if you have young children, that for me really helps with my stress. I do something called eccentrics, which is a stretching and strengthening activity that just helps you move. It's movement. And I don't feel great all of the time. I walk slowly, I can walk, I can do things, but eccentrics is like a mind-body activity. So it doesn't have to be that, but something that where you're moving your body and thinking at the same time, I find so good. I also do walks. I have a dog, so I walk the dog. I try to do a little bit of journaling and meditation as well during that morning routine, and I do those things first thing in the morning. So that's that answer. But I think that there are lots of ways to de-stress, even with little kids. But you have to make that time for yourself.
Yeah, I know. I try to find time to meditate and take baths as much as possible. Who haven't we asked? Allie, I know you were having some technical difficulties with your computer, and I'm so glad you made it back. We're just talking about what we do to de-stress as moms, and especially as we're going into Mother's Day. Any tips, tricks?
Yeah, so sorry about all that technical stuff. My computer just decided to wig out, and I was like, this is not good time for that. But I think as far as I agree with every mom, all of you who have, talked about taking care of yourself. I agree with that. And I think also keeping some normal in your life. I feel like when you enter into a SADS journey, I like to call it, after your SADS condition being diagnosed, it feels like your world kind of turns upside down. And it's super easy to slip into anxiety and depression when it comes to that, because it's a rare thing and not many people have it. If you keep normal things in your life that you like doing, that's also taking care of yourself. So that could be going on a walk, that could be taking a bath, that could be doing these things, but just trying to keep those little senses of normal in your life can go a long way. And also children.
Yeah. What was the last little bit? I didn't mean to step on you.
You're good. And even for your children too, it helps them cope everything to have a little bit of normalcy in their life. And so even though it's something so simple, I think it can go a really long way.
Absolutely. They are watching all the time. So if they see us finding ways to relax, then that's kind of teaching them without even saying anything. Alessandra, sorry, I left you for last, but I think it'll be interesting to hear what you do to relax. You have a very active child, so tell us a little bit about what you do.
Yeah, I found myself video editing and things. That's not necessarily relaxing.
It might be for you.
Not yet. In addition to exercise, like everyone said, which is good, whatever form you can take it for yourself. And like Allie was saying, you can't pour from an empty cup. So if you're not attending to what your need I just kind of like that escape entertainment, whether it's reading a book that's like another world, just something so different, or watching a movie that I can really disconnect from my real life. I appreciate that.
Oh, that's wonderful. Thank you for sharing that. All such great conditions, all such great advice. And I think we could have made this 4 hours long and filled every minute of it. There's so much to dive into here, and I don't want anybody to feel like they're left hanging as we come to the end of this episode. So please remember about the Parents Connection, Sad Parents Connection. The first Tuesday of every month at 7:30 Eastern Time. And then lastly, I want to say to all the parents out there and all the mothers who are getting ready to celebrate Mother's Day and have lost a child, as I have, that my best advice to all of you is to remember that they are always with you. And if you're anything like me, then you have received signs from your children and things that are undeniable. And I really hold on to those. And instead of mourning the loss on Mother's Day, I really dig into my heart and remember all the wonderful things about my son and all that makes me a mom. And know that he's still, here with me and here with my son who's still on this side of heaven. So, I hope all of you can hold that in your heart as well and find some joy this Mother's Day and some time to take to yourself, because hats off to all of you. It's not easy being a SADS mom, but it sure is rewarding. And thank goodness we have a place like SADS where we can all come together on common ground. So we hope to see you all soon. I want to thank everybody on our panel, Sandy, Alessandra, Allie, and Christy, for taking time out of your busy days to be here once again, as you always are, for our SADS families. And please say hello and give a hug to all of your children. And for all of you out there, happy Mother's Day. We'll see you next time for SADS Live.